Let's start by considering the characteristics of the bacterium Clostridium tetani. It lies dormant as a spore form. Oxygen is its enemy, and only when entering anaerobic conditions does it germinate into the vegetative form, a bacillary body with a terminal spore, the shape from which it gets the name drumstick organism. The spore disintegrates. And the resultant bacillus multiplies by binary fission at the same time releasing a neurotoxin. And this is what does the damage in from 2 to 28 days. However, the incubation period is commonly 7 to 10 days. The body builds up no natural immunity to an attack of tetanus. And while penicillin and other antibiotics are effective against the vegetative form only, not the spore, the antibiotics cannot effectively reach bacilli situated in anaerobic wounds, the very areas, of course, where fresh blood is not circulating. Now, these characteristics of the organism are relevant to prevention and treatment of the disease. So let's study them more closely in animation.
The highly refractile spore state of Clostridium tetani, at this stage resistant to penicillin and other antibiotics. It enters the right environment, an anaerobic wound, and throws out a germ tube which grows into a long, thin bacillus, usually with spore remnant attached. This is the vegetative form, which would be sensitive to some antibiotics if they could reach the organism. Under the anaerobic conditions, it now multiplies rapidly, and towards the end of this growth, we believe the neurotoxin is liberated. Once the toxin attaches to susceptible nerve cells, the symptoms of tetanus ensue. The fixed toxin cannot be neutralized readily, and such small amounts are needed to produce disease that the body fails to respond with any natural immunity if the patient recovers. This progression of events usually takes 7 to 10 days before the symptoms and signs become evident, but under certain conditions, the incubation period can be as short as 48 hours.
No naturally acquired immunity, antibiotics unreliable, 7 to 10 days, even less, in which to counter infection.